In this video, we discuss the use of Thymosin Alpha during cancer treatment. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. This video is intended as information, not medical advice. It is not intended to treat, diagnose, or cure any disease. Any medical advice should come from an appropriately credentialed medical professional familiar with your unique circumstances. Thymosin Alpha 1 is a peptide naturally occurring in the thymus and has been studied since the 1960s. It is approved for human use in 35 countries for many indications, including cancer. T cells mature in the thymus. The thymus ensures that T cells react to non-self antigens and not to self-antigens, so that they attack invaders only and not the self. The main mechanism of action of Thymosin Alpha against cancer is through the upregulation and sensitization of the immune system. It promotes the activity and maturation of natural killer cells, increases the production of interleukin-2, a molecule that signals to make more white blood cells and interleukin-2 receptors, and even directly attacks cancer by attaching to receptors on the cell membrane. Because Thymosin Alpha is produced within the body, it has extraordinarily low toxicity. It also synergizes with many medications, especially chemotherapy, immune checkpoint inhibitors, and interferon without significantly increasing their toxicity. Thymosin Alpha has been through many clinical trials and has ample human evidence, all of it positive with very few side effects. One trial of dacarbazine, a chemotherapy drug, Illinois, 2, a rather harsh immunotherapy drug, and Thymosin Alpha in metastatic melanoma patients produced a 36% response rate. Responses for dacarbazine with IL-2 are typically about 23%. Importantly, there were no additional toxicities when Thymosin Alpha was added to the treatment. Another trial with stage III and IV melanoma patients produced a 50% response rate when Thymosin Alpha was added to dacarbazine and low-dose interferon alpha, an endogenous signaling protein. Again, no additional toxicities were observed due to the inclusion of Thymosin Alpha. The Thymosin Alpha group also showed improved effects on natural killer cells and CD4+ helper immune cells, while the dacarbazine chemotherapy group alone showed reduced function of these cells. When Thymosin Alpha was added to the immune checkpoint inhibitor ipilimumab Yervoy in late-stage melanoma patients, it increased overall survival from 8 months for ipilimumab alone to an astonishing 38.4 months, with no added toxicity. Thymosin Alpha has also shown efficacy in liver cancer. It increased survival when given after liver surgery compared to surgery alone. It also improves outcomes when given concurrent with liver tumor ablation and TACE, transarterial chemoembolization, a non-surgical procedure to reduce liver tumors. When Thymosin Alpha was added to sorafenib, a main liver, kidney, and thyroid cancer targeted therapy drug, it improved median survival time and immune parameters. Cancer Self-Defense 101 summarizes over a dozen other human trials using Thymosin Alpha during cancer treatment, all of them positive. With so much success in human trials, including numerous phase 2 trials, you would think Thymosin Alpha would finally be put through a phase 3 trial to potentially make it part of the standard of care in some cancer type. A company called Cyclone, who made a synthetic analog of Thymosin Alpha called Thymolfasen, received approval to conduct a phase 3 trial in melanoma in 2008. For some reason, this was never undertaken. Cyclone was bought out by an investors consortium for over $600 in 2017. Its only approved drug was Thymolfasen. There are no indications of any plans for a phase 3 trial of Thymosin Alpha to be undertaken anytime soon. Fortunately, Thymosin Alpha can still be found online as a research chemical and can be prescribed by integrative physicians. For more information, please see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.